What did doctors think caused PID before bacteria were found? Imagine a time when doctors knew something was wrong but didn't quite understand what was causing it. Before bacteria were identified as the main culprits, pelvic inflammatory disease was seen as a mysterious condition. Doctors thought it was a general inflammatory response, meaning the body was reacting to some irritation or injury without knowing the exact cause. They believed it might be linked to trauma from childbirth, miscarriage, or other disruptions in the female reproductive organs. Some even thought it was caused by unknown inflammatory processes that couldn't be explained at the time. Back then, the medical literature from the mid-20th century and earlier described PID mainly as an inflammation of the female reproductive organs. They didn't have the tools to identify specific microbes or bacteria. Tuberculosis was recognized as a rare cause of pelvic infection, but the role of bacteria that spread through sexual contact wasn't understood yet. Because of this, many cases of PID were considered idiopathic, meaning the cause was unknown. Doctors thought it might be related to general infections or other nonspecific factors. It wasn't until the 1950s that scientists started to connect certain bacteria to PID. They identified tuberculosis and the bacteria Neisseria gonorrhea as causes in some cases. However, these were only a small part of the overall picture. Most cases still had no clear microbial explanation. It was only with advances in microbiology and diagnostic techniques that the understanding shifted. Researchers began to find that bacteria like Neisseria gonorrhea and later Chlamydia trachomatis were the main infectious agents responsible for PID. This evolution in understanding changed how doctors approach the disease. Instead of seeing it as a vague inflammatory syndrome, they now recognized it as an infectious disease caused mainly by bacteria that ascend from the vagina and cervix into the upper reproductive organs. Today, we know that bacterial infections, especially sexually transmitted bacteria, are the primary cause of PID. This knowledge helps guide prevention, diagnosis, and treatment strategies. It's a great example of how medical understanding develops over time, from guessing to knowing with scientific certainty. Always remember, if you have concerns about PID or STDs, consult a healthcare professional for personalized advice and proper testing.